And there are many questions that you may have when it comes to taking care of your family, your finances, and especially your health. Government programs like Medicare can help to ensure security when you retire. However, enrollment can be a confusing process. South Bay Health and Insurance Services clears away the confusion by serving as a resource and advocate for all of your continued health care needs. So join me now to talk about Medicare assistance and exactly how you can finally pick the right Medicare plan for you is South Bay Health and Insurance Services President Patricia Salas. Patricia, always good to see you.
Thank you so much.
So let's talk about South Bay Health and Insurance Services. Exactly what is it and what do you do?
SBS is an insurance agency that specializes in helping people that have Medicare or Medicare and Medi-Cal find the plan that best suits their needs. All of our services are free of charge and we are completely neutral. So what we do is we focus on the client, make sure that we find what makes sense for them and assist them in the enrollment process.
And as mentioned, you kind of clear away the confusion and maybe even a little bit of the intimidation of going down that path. It's always great when you have guidance and some information of what exactly you need to do.
It's very confusing. As you get closer to Medicare age, which is traditionally 65, or you become 65, you get inundated with paperwork and information, advertising, marketing, etc. Most people don't know what is right, what is wrong. Some of them used to have group coverage through work. The employers will tell them what to do during open enrollment season, and now they're retired, they're left on their own.
Yeah.
So they have to go and figure out, how do I get the coverage I need? We specialize in educating them and giving them the tools necessary so they can make the right choice.
That's great. And let's talk about low-income subsidy. What is that and who qualifies for it?
Low-income subsidy is a federal program available to people with Medicare. I love to talk about it because the funds in the program go heavily underutilized. It's one of those things that we fund. It's available for people that have Medicare. Many people think, oh, it's only for those who have Medi-Cal or are really low income. It's not. It's actually for those who have Medicare and don't have any additional assistance and are in a plan. They could even be in a plan and reduce their costs. What it does is, based on the level that you qualify for, the cost of your prescription drugs gets reduced. So let's say you're in a managed care plan today, you're in a Medicare HMO, and you're paying $30 or $40 for your brand name medication. By joining low income subsidy or applying for it, you could drop the cost of that medication down to $3.30.
Wow.
Exactly. So if you have medications that are extremely expensive, sometimes they are considered non-preferred brand name drugs. We have members that are paying up to $100, $150 per fill.
Wow.
And let's say that you ended up happening to be in the highest tier of low income subsidy. You would pay 15% of that drug.
Wow.
Instead of the 100 and something that you were paying. So for the most part, it saves our seniors a ton of money.
Yes.
Most of them don't apply because they don't know they qualify for it.
Or
so
maybe they don't even know about it because once again, the support they had before is not there.
The idea that we have is that any type of subsidy or assistance is only available for those who are low income, and that would in turn be Medi-Cal, which in many cases may lien your home or other things like that. This has nothing to do with it. In the program, you're allowed to have a home, one property. You're allowed to have a car. You're allowed to have savings, and none of that is touched or bothered. So I'll give you some of the qualifiers. If you want to qualify for the lowest level or the greatest assistance, as a single person, you must make less than $930 a month. If you're married, less than $1,260 a month. If you qualify there, again, your co-payments for prescription drugs will be $1.10 for generics,
wow,
$3.30 for brand.
Wow.
The next level up goes up in income. If you are below $1,257, $1,257 for a single person, or $1,703 for a married couple, you qualify for your copays to be dropped to $2.50 for generic, $6.50 for brand.
Wow.
So again, this is all brand. Even those that are in the non-preferred tiers would be dropped to that level. It's a huge savings if you're paying $150 down to $6.50.
Absolutely. And Patricia, where are you guys located?
We're in Sacramento. Our newest office is here. We have 12 offices, but the big one is now here. We have a new corporate office. We just opened it. That one is at 2424 Arden Way, and it's Suite 130. We're next to Social Security, and they can call us. The number that's on screen, I don't know if it's up there yet, it's 888-988-8682. Have anyone give us a call. We will gladly assist them. They can come to our offices, apply all of the assistance at zero cost. It takes about 2 weeks to apply, and if you qualify, you receive a letter in the mail. Once you get that letter, we can go ahead and help you further.
And I imagine all the services are available at that location too.
Everything's available there, yes.
Awesome. And really quick, for our viewers that already have Medicare, what should they do?
they have Medicare, they should give us a call.
Okay.
When you have Medicare, the very first thing you want to do is confirm that the plan you have is correct. Many don't have a plan. Many have the incorrect plan. So understand your options, get educated, get informed. All of our services, again, are free of charge. So just give us a call, find out. And one final thing we wanted to tell you, we're still hiring. So if anyone out there is looking for a job, we're looking for our call center. Our call center, we need more people on the phone.
Great.
So we have 8 openings that are available now. So if anyone's interested, again, just give them a call. Be quick about leaving your number and they'll get back to you.
That's wonderful. Thank you so much. So
You're
good news
welcome.
for everybody watching today.
Wonderful, yes.
I appreciate that.